So good morning, everybody, and welcome to this month's Security Health Plan Academy. We're delighted to have you join us for our monthly webinar series, which covers topics directly related to your health, wellness, and healthcare plan. Today, our focus is on Freespira's innovative treatment program, which is designed to provide relief from symptoms associated with panic and post-traumatic stress disorders. During this webinar, you'll learn more about this FDA-cleared treatment option and the next steps for getting started. Leading us through this informative presentation today is Monica Frederick, the Vice President of Strategic Accounts at Freespira. Monica has over 20 years of experience leading teams for innovative solutions that enable health plans to increase access to care and improve outcomes. She holds a bachelor's degree from Syracuse University and a master's degree from Arizona State, both in clinical dietetics. I can't talk today. We were fortunate enough to get a sneak peek at Monica's presentation earlier this week, and we're excited to have her share this wonderful information with today's audience. If you have any questions during the live presentation, please feel free to submit them via the chat feature located toward the bottom of your screen. We'll address those questions after we've gone through the slide deck. And one more note, just to please keep your microphones muted during the presentation to minimize distractions. We're thrilled to have each and every one of you here today. And now, after addressing those few housekeeping items, I'm anxious to get started. So without further ado, Monica, the floor is yours.
Thank you, Ashley, and thank you everyone for joining. And let's get started by really understanding what is panic disorder and what is PTSD. To start with, panic disorder is an anxiety disorder, and it's characterized by unexpected and repeated episodes of intense fear, even when there is no clear danger or trigger. And this intense fear is accompanied by physical symptoms. Your heart may feel like it's pounding out of your chest. You think you're having a heart attack. You're shaking, you're nauseous, you're trembling. These are panic attacks. And the condition is extremely debilitating. Many people with panic attacks live in fear of when will the next panic attack occur, because often they seem to just arise out of nowhere. People often start to avoid places where the last panic attack occurred. Extremely debilitating, as is PTSD, or post-traumatic stress disorder. So post-traumatic stress disorder can develop after exposure to any traumatic event. And sadly, many war veterans suffer with PTSD. You're probably all familiar with that. But I do want to make it clear that anyone at any age can suffer with PTSD. We know that women suffer with PTSD twice as often as men. And when I say exposure to a traumatic event, I mean either you experienced the traumatic event yourself, or you witnessed someone else experiencing a traumatic event, or you heard about it happening to a loved one. So these types of traumatic event could be, of course, war or combat, but any kind of physical or sexual assault, abuse, a horrible accident, disaster, hearing about an unexpected death of a loved one, and also repeated exposure to trauma. So think of police officers, firefighters, frontline healthcare workers that almost every day see trauma. And we know that about 30% of first responders suffer with PTSD. So really, really debilitating conditions. As I mentioned, the conditions are felt physically. So the symptoms are extreme. Like I mentioned, you feel as if you're having a heart attack. Your heart is pounding out of your chest. You're nauseous. You're tingling. You feel lightheaded. Post-traumatic flashbacks. And exaggerated startle reflex if you hear a noise that reminds you of a trauma, difficulty sleeping, feeling like you're choking and trembling, and fear of losing control. So really debilitating conditions. Most people with these conditions, they can choose a couple different treatments. One would be psychotherapy, which some people just don't want to engage in psychotherapy, and it might be a long time until you can get an appointment with a therapist. And the best type of therapy for people with trauma is exposure-based therapy. And that means you need to relive the trauma. Most people don't want to sign up for that. And studies have shown that people who do, over 50% drop out before they complete treatment. The other option has been medications for people with these conditions. Some medications carry a severe risk for abuse or addiction. Other medications used for these conditions have a very high side effect burden, so difficult to stay with the medication. And any medication that once you stop it, most likely the symptoms will return. So there's another option, and it's Freespira. And I will mention that Freespira can be used alone or in combination with therapy or medications, if that's how, what you're currently doing. So what is Freespira? Freespira is FDA cleared for the treatment of panic disorder and post-traumatic stress disorder. And it is a covered benefit for most security health plan members. Let me first start out by telling you a little bit about the company. Freespira was founded with a tremendous amount of passion. There was a woman who was suffering with panic attacks, and she enrolled in a study at Stanford University. She was so thrilled with the study outcomes, eliminating her panic attacks, that she founded the company based on the Stanford study treatment protocol. And that's what we deliver today in the privacy of your home. The researchers at Stanford recognize that people with panic and PTSD tend to have dysfunctional breathing. They tend to be chronic hyperventilators. Just sitting here, they could be breathing quick enough to support a brisk walk. They're sighing, they're yawning. And this dysfunctional breathing arises from an underlying hypersensitivity to carbon dioxide. So they thought, if we could normalize the breathing, could we eliminate or significantly reduce the symptoms of panic and PTSD? And yes, you can. And so, as I mentioned, we deliver now their protocol in the privacy of your home. So the way we do it is, if you are enrolled in Freespira, you'll receive a small box. In that box will be what you see here, the Freespira system. There is just a simple nasal cannula that just takes samples of your exhaled air. That is attached to a proprietary sensor. This sensor is measuring your respiration or breathing rate and your exhaled carbon dioxide. That information is Bluetooth to a simple tablet. This small tablet is in the box, it's part of the system. And this shows you in real time your exhaled carbon dioxide level and your respiration rate. So the ask for the patient is pretty simple. Breathe in sync with rising and falling audio tones, and watch your tablet to see where is your exhaled CO2 and respiration rate, and learn to normalize your breathing to bring them into the normal zone. This is a treatment that's done for 28 consecutive days, and there's twice daily sessions. Each session is 17 minutes. So now you've done this for 28 days, twice a day. Once you're done with that 28 days, you will simply put the system back in the box, put it on the return shipping label, and ship it back to Freespira. However, a really important piece of the Freespira treatment is each patient is assigned a Freespira coach. That coach will stay with you throughout the 28 days. First time you meet your coach is on a secure Zoom call, and your coach will explain the treatment, ascertain your goals for treatment, and schedule weekly follow-up calls with you. Meanwhile, all of the information from this tablet is securely sent to Freespira. So every day your coach can see, are you getting your carbon dioxide into the normal range? Have you missed a day or two of treatment? So in between the scheduled calls, your coach might call out to you and say, I see you missed a couple of days. Let me help you get back on track with the treatment. Likewise, if you have questions between the weekly schedule calls, you can call your coach. So you've got the same person with you throughout the 28 days. So it really becomes very easy for the patient and very successful. This is what you'll see on that tablet. So this is one of our panic patients. This is day 1 of treatment. This green jagged line is their respiration or breathing rate. This patient is breathing about 20 breaths per minute. And their blue line is their exhaled carbon dioxide level. And it's well below the normal. The normal would be right here in the blue zone where you see the white dotted line. After just 7 days of treatment, you can see this patient is nicely breathing at about 13 breaths per minute, still struggling a little to get the carbon dioxide in the normal range. After 28 days, patient is breathing nicely at 6 breaths per minute, exhaled carbon dioxide all in the normal range. You have now learned a new way to breathe, and you have a skill that you can take with you for really essentially forever. If you're in a triggering situation, you can go back to your breath, what you've learned through Freespira. So now 28 days are done. You put it back in the box, send it back to us. Think of it like the training wheels on a bicycle. Once you take them off, you don't need it again. Once you return the device, you have learned this skill and you can call upon it anytime. You've really changed your breathing pattern. Some of our patients like to hear those tones that I mentioned, that rising and falling audio tone. After you complete treatment, we send a tone app to you. It's not an app you buy in the Apple Store. It's something that we provide for our Freespira patients. So let's take a journey through the Freespira experience with Jerry, who is a patient. Jerry will start his journey with a telephone conversation with a patient account representative, a Freespira patient account representative. So here's David, and he will talk, with Jerry on the phone, and just make sure that Jerry meets the requirements for a successful treatment. Has Jerry got 28 consecutive days, twice a day to do the treatment? We'll also ask you to take a short survey using screening tools, one for panic or the other for post-traumatic stress disorder, to see if you meet the symptom severity level that we can help you. David will also check your insurance to make sure that you are eligible for treatment. The next step, and this is all done virtually, is Carrie Lynn, one of our registered nurses, will then do an assessment. She'll look at the screening tools, make sure that you're appropriate for treatment. Once she authorizes you for treatment, that's when we ship you the device and we schedule your first training session with your Freespira coach. So Natasha is one of our coaches. She is going to be Jerry's coach throughout the 28 days. So they'll go through the 28 days together with at least weekly check-in calls, more if needed. And as I mentioned before, after 28 days, just put the system back in the box, put on the return shipping label, send it back to Freespira, and then we'll send you that Tone app. We've treated over 5,000 patients, and I wanted to share a couple stories from Security Health Plan members who have really had tremendous success with Freespira. This patient reports, "I feel so much better. I am sleeping better, and I've had only one nightmare this month. And it wasn't even my recurring nightmare. It was such a relief." My head feels clearer, and when I start to feel the panic, I just breathe. I had set my expectations low because I was afraid to fail and let myself down. And the results are so much more than I could have ever dreamed. I have been told for years that I was beyond help. And this was so much more than I ever expected. I would recommend this treatment to anyone. Another patient story was notes from the patient's coach. And this coach reports, I wrapped up a patient who has had really wonderful outcomes. The patient is elderly and with no access to internet and is not tech savvy, so was highly grateful for the opportunity to participate in treatment despite those details. The patient has become more anxious and had recently been experiencing frequent panic attacks and difficulty regulating emotion. The patient was highly motivated throughout the treatment, the 28 days, and by the end of the treatment reported 0 symptoms. Like I said, we have hundreds of these stories, but really tremendous outcomes for the patients who engage in the Freespira treatment. So how do you get Freespira? You may have noticed that you've got a mailing from Security Health Plan about Freespira, or maybe an email or a text message. This is one example of something that may have wound up in your mailbox. And you can see it just talks about the symptoms of panic and sleeping problems, feeling irritated, chest pounding. And then it gives you a 1-800 number that you can call us, or the Freespira website, or a QR code that you can scan and schedule your first call with a Freespira representative. This is another example of a mailer you may have received. Again, this one's talking about the symptoms of trauma and showing again, call us or scan the QR code to schedule a call with a Freespira representative. And we're excited about this. Just last week, we posted a billboard over on Chestnut Street in Marshfield. You may have seen it, but really talking about Freespira, and it's got the 800 number as well as the website. So let me take you to the website. This is what you'll see. You'll simply go to freespira.com/SHP. And you'll see this landing page. And then you can just click through where you want to learn more information, talking about symptoms, shaking, trembling, chest pain, sleep problems. And when you get to this page, you'll see that there is a 3-minute video. And you can watch that video, and it's really a great video because it actually shows, a patient going to their front door and getting the box and starting their treatment with their coach. And this is actually a picture of one of our coaches working with a patient via the secure Zoom meeting that they have. And so very, very simple to get started. If you feel that you might benefit from Freespira, just give us a call or schedule an appointment to talk with a Freespira account representative. And once we determine if you're appropriate for the program, we'll ship the system and start you on the treatment. Let me pause there and ask, are there any questions?
I don't see any questions in the chat feature for now, but I do have a couple that we'll ask towards the end that were submitted.
And I think this is a good time.
This is it.
Great.
So let me pull up those questions. Oh, there is one that just came through that we can tackle right now. It says, can you tell us what the device does?
Yeah. So what's the device? And I'm going to go to that page that shows it. This nasal cannula is sampling your exhaled air. So nothing's going into your body. It's sampling your exhaled air. And it is attached to this proprietary sensor. Oops, excuse me. And the sensor is measuring in real time your exhaled carbon dioxide level and your breathing or respiration rate. So again, nothing goes into you. It's measuring what's coming out in your air. That carbon dioxide level and respiration rate is then Bluetooth to this simple tablet. So you can watch in real time your exhaled carbon dioxide level and respiration rate as the tablet is giving you the rising and falling audio tone. So you're trying to pace your breathing with that rising and falling audio tone. And excuse me, but I'll just tell you what it sounds like. It goes, So it's slowing down your breathing. So during that time, during your twice daily sessions, you're trying to sync your breathing with that rising and falling audio tone and get your carbon dioxide in the normal range and your respiration rate in the normal range. Hope I answered your question. I'll give you a few minutes to see if something comes back in the chat.
And while we're waiting for that response, here is a question that was submitted in advance. If I am in therapy and taking meds for PTSD and anxiety, do I need to check with my doctor first to start Freespira? Can I still use Freespira if I'm doing these treatments with my providers?
Yes, absolutely. Freespira can be used in conjunction with therapy and or medications, or it could be used alone. So that's the beauty of it. You don't have to stop with what you're doing. If that's working for you and want to add this as an adjunct, you can do that as well.
All right. It said, how do I know if I'm a good candidate for this treatment? Is there a screening process?
That is a really great question. So yeah, there is a screening process. We will ask you to complete a short survey. There's one tool, we call it a tool because it's a validated symptom severity tool. There's one for panic disorder, there's one for PTSD. So we'll ask you to answer some questions, just how it's affecting your life, how panic or PTSD is affecting your life. And then we will use that tool to determine, are the symptoms severe enough where we can help you? And a distinction would be, and I don't want to use the word just, but if you have generalized anxiety disorder, but you're not suffering from panic attacks or post-traumatic flashbacks or symptoms, you would want to use a different type of treatment. This is for people with truly suffering with panic attacks or post-traumatic stress disorder.
And a follow-up to the first question we had. So this is a feedback mechanism that trains you to regulate your breathing. Is that correct?
Excellent. Yes.
Okay. Here's another one that was just submitted. I have friends and family that have received advertisement for this in the mail. They are not a part of Security Health Plan, but are interested in the program. Is this something offered? They are not part of Security Health Plan, but are interested in the program. Is this something offered to, let's say, both Security Health Plan and non-Security Health Plan members?
Yes. So that's the beauty of the phone call. We will check when that family member calls. If they're not part of the Security Health Plan, we'll see if they're with another health plan that covers Freespira, and if not, we have a payment option for people that would like to start Freespira, but they don't have insurance coverage. So please just call the 800 number and we can let you know.
Wonderful. I don't know if this is a question or comment, but it says also is treatment for limited symptom is also for is treatment for limited symptom attacks as well. And you can text with your coach versus calling. So let's pose that as a question. Is the treatment for limited symptom attacks, and can you text with your coach versus call?
Let me start with that's a very easy one. Yes, if you prefer texting, you can definitely text with your coach. we will ask that you actually have that first meeting with your coach via secure video, because they want to help you learn breathing style. A lot of people with panic and PTSD, they tend to breathe from their upper chest. They're like, we want to teach you to breathe more from your abdomen, from your stomach. So the first call is best done in a secure video. After that, you can text. That's absolutely. And I think I'm going to make an assumption on the first part of the question, because that was a really good question. This treatment is done not when you're having a panic attack or PTSD symptom. This is done as a way to retrain your breathing. So you don't have to be in a panic attack, having a panic attack right away to do this. Once you're having a panic attack, you would just go back to your breathing, what you've learned. So you're not suffering with symptoms and then do the treatment. You do the treatment twice a day for 28 days to retrain, as the other attendee mentioned, to retrain your breathing pattern. I'm hoping I answered your question, so I'll wait a minute to see if something comes back in the chat.
Okay. Another question, do the daily sessions need to be done during the 8 to 5 p.m. business hours?
Love it. We ask about a 6-hour difference. So if you would rather do it, at 6 in the morning and then 8 at night, it doesn't matter. We like about 6 hours in between sessions, because remember now, once your coach has taught you after that first training visit, then you'll go for the next 7 days before your next check-in with your coach, doing this twice a day for consecutive 28 days. So do it when it fits into your schedule. It doesn't matter with us. It's best to have a few hours in between daily sessions.
Another question. I am not that tech savvy. How will I know how to use the equipment if I am using it by myself at home?
Yeah, love that. That's, as I mentioned, the importance of that coach. So that first training visit, 45 minutes to an hour, that coach won't leave until you understand how to use it. It is pretty simple to use. You just put the nasal cannula behind your ears and breathe as you normally breathe, turn on the tablet, and it will connect. So, but that coach walks you through that. And then that coach is there. If the next day you forgot something, just call your coach or text your coach and say, I don't quite remember how to turn this on, or whatever the question might be. So yeah, we don't want that to be a barrier to you getting treatment.
So I'm going to go ahead and ask another question. I have some underlying respiratory issues and sometimes have a hard time breathing, but I still need help with dealing with my panic attacks. It is causing me to have trouble sleeping. Can I still do the treatment?
Yeah, that's a really good question. So the only time you would not be appropriate for Freespira, remember, we're changing your breathing pattern. If you have very advanced lung disease with respiratory impairment. So what I would ask is call us and also get a medical clearance if you think, do I have really advanced lung disease? And let's just get a medical clearance. If you don't have advanced lung disease, there's no reason why we could not start you on treatment.
Well, here's one more for you before we go ahead and close. Will I relapse if I stop treatment?
Great question. We have had published studies that have gone out to a year. And we know from our patients past a year, we do not see a relapse rate. Remember, it's minimal. It's minimal. I never say, never, but it's extremely minimal. Remember, you've got 28 days to retrain your breathing. And once you ship the system back, you've got that tone app to remind you of the pace. So we very, very rarely have seen someone who needs another treatment session, another 28 days.
All right. Well, I don't see any other questions in the chat feature, and it is noon, so we can go ahead and bring this session to a close. Thank you so much, Monica, for joining us today. It was wonderful. Thank you so much.
Thank you all for joining and your really great questions. I appreciate everyone. Thank you.
All right. Have a wonderful day, everybody. Be well.
Bye-bye.